Hi, my name is Vrinda Patel, and I'm going to be talking about what a dental front desk personnel does. You can also call them an administrative assistant, and sometimes in a smaller practice, they are your office managers as well. So, I thought it would be a very nice topic because I was working as a dental front desk and administrative assistant for a practice, and I would have the dental assistants and the office manager come up to me and be like, Vrinda, what are you doing behind the computer all day? And why are you just calling people all time? And I felt like they didn't understand what we're doing up front. I feel like if you know what administrative assistant do, you can work with them, and it could be a very nice teamwork. So if you know everything about what they do, I suggest you skip the video, but if you're still interested in listening more, keep watching. So I've listed down into like 7 to 8 categories. I might be missing few of them just because it's about my experience in one practice, but it's still like in a whole nutshell of like what they're gonna be doing in a typical like daily. What do they do routinely? So the first thing that happens is they're checking in patients. So we have the patients walk in, and the first person that they interact or meet is the front desk or your receptionist, right? And the what they're going to be doing is definitely verifying or completing their registration forms and helping the patients complete the registration forms. So when a new patient walks in, nowadays they do have a link sent electronically before on how the forms that they need to be submitting. But even and if it's like a paper like registration forms, what they do is they're having like 3 to 4 forms that they need to fill up. It's usually about patient information, medical history, dental history, or it would be privacy forms like the HIPAA forms that are required, something about informed consent as well. So with patient information, an adult would be having like their personal information, an emergency contact. They would have their address, their contact number, email address. And if it's a child, like you want to also capture the parents' information as well. Yeah, and social, because sometimes your insurance is linked with your social ID, not but these days it's not like so much interlinked with your insurance ID, but sometimes it's easy to like interlink them when if you need it for your insurance. So those are the things that you want to keep in mind that they do. And with an old patient, a patient who's been there before, they need to update their address and their phone number, because if they relocate or if they've changed from an apartment, they moved into a house or something, you want to have their most updated address. And why would you need their updated address is because for financial reasons. What if you have to send them a statement? I'm sorry to say that out front first, but maybe for other legal purposes. And yeah, so it's just a way to contact your patients. Or you're sending out greeting cards or something, you still want to have their updated contact information and address. So uh, yeah. And the software that they're using is dental eaglesoft and dentrix. Nowadays they do have many other softwares that they're using for checking in patients differently as well. And there's just a lot of dental applications that are there that they've been using a lot. So yeah, so the other thing that they do is when they check in is they're scanning their ID and scanning their insurance. So you want to have that on file. And like an ID is important when you're seeing a patient, so it's always there on file. And insurance information also keeps changing, so you want to have like the patient's insurance ID scanned in as well as much as possible. If they have it, it's good. If not, then um, if they remember it in any other form, that's fine as well, but an ID is very important. an ID is very important for a child as well, because you want to have the parents' ID in the child's chart, like, so that because they are responsible for their children, right? So you want to have in the parents' ID, any parents' ID in their patient's chart as well. You want to keep this in mind, especially during pediatric and orthodontic treatment, because for pedo and ortho patients, because those are the ones, like, mainly children are involved during those procedures. And not that they don't come in routine care, but it's just that they come more frequently during those treatments. And in orthodontic treatment, because they are adolescents, like, somewhere around 12 to 16, you still want to have like a parent come in before you see the patient or the child, because and that's for legal purposes, you can be in trouble for that. So yeah, you want to keep that in mind. And every state has a different law, but I feel like with that ID, everyone's still going to be having the same law, like, everywhere. But the second thing is, what they do is verify insurance, right? So a big part of what they do is the front desk does is verify insurance for new patients and for old patients, because insurance information is likely to be changed when your patients are changing their jobs as well. Like, they're gonna have a different dental plan from a new employer. And for new patients, you still want to know about their insurance information. So when you verify information, I'm going to start with Medicaid and Medicare. So you can they're confirming their eligibility online. They usually have an eligibility ID, and what else you need is their date of birth, and then go from there. So every state it's different, and sometimes the state insurance change their plans without telling their patient, and it happens a lot. And the patient's like, I know I'm enrolled in this plan, and, like, unfortunately they enrolled in some other plan, but you will still have to like verify it. With Medicaid and Medicare, usually on the first day of the month, you might want to double check it. They're fine throughout the whole year, but I feel like during the first day of the month, they're likely to be changing a plan if the state does it without not telling them at all. But yeah, it's just good to check the eligibility online as much as possible. That's what they do. And then for private insurances, what they do is they're verifying the insurances through the online portals, which is easy. But where it comes to be a little bit stressful is when you're calling your private insurances and you're lot on phone, like, but the best thing I feel like I would do is, instead of being a lot on hold, they have a prompter of, like, entering in the patient's information. That would be the eligibility ID or the date of birth, and then you can get a fax back of the insurance breakdown. So I will go ahead and select that, get a fax back, so it's easy to, like, get the breakdown and not be on phone for such a long period of time. But there are times when you have to be on the phone. But yeah, so that's what you do. And you can, like, if you're calling Blue Cross, Blue Shield, like, you might want to get the insurance verification for the other patients that are required to. So you want to have all those eligibility IDs and their date of births in handy, so you can get a fax back for all those patients together. And you can also request for a family plan, like, insurance breakdown together as well. So in case of if the family's been seeing together, you have the insurance information for the other family members as well, who might be seen or who are already a patient and they might be seen. So once you get the facts back, I think the facts back is about, like, I would say 10 to 20 pages, depending on how detailed they are. Um, and what they do next is they fill out an insurance verification form. So they're combining those 20 pages into one nice paper. So you'll just have everything written down in that one sheet, and that is what is present in their patient charts as well. So anything you want to look up, I feel like they put it into their patient charts. And I know I did have to make a video about how to read the insurance verification form and the insurance breakdown, but I'm still working on it. I will definitely get there. The fourth thing that they're doing is treatment planning. And yes, when they come up to the office with that piece of paper, yeah, this is your treatment plan. Sometimes when you're presenting the treatment plan, I think it's good to have the front desk personnel together, and like obviously the dentist steps in if it's their private practice, or you might have to, like in different DSOs, I feel like the front desk presents the treatment plan, and what they're basically saying is based on the insurance information that they've provided, they're going to be saying what the deductible is and how much the insurance is going to be covering and how much is the patient's responsibility. Sometimes they need to be presenting a two to three treatment, like two to three different treatment plan, depending on what the dentist has mentioned. Like suppose you're getting for a patient with no teeth, like we're gonna have, like, are we having dentures or are we placing implants at that point? So there's going to be a treatment plan for dentures, and then the second treatment plan is going to be for implants. So maybe the insurance is covering with the dentures, and maybe the insurance is not covering with the implants, or like if it's a private insurance, maybe it's covering 50% with an implants and not together. So it's just that they still need to have a treatment plan for both of them together. Some patients do have two insurances as well, so they need to see which insurance is going to pay them up first, and then whatever the leftover is the second insurance going to cover that as well. So they need to discuss all those things together with the patient, and the patient needs to have a clear understanding of their finances before they get started with the treatment. And that is a very important step for any patient and for the dentist, for the practice altogether, to be it's just a very important step up there, because they're making the decision to start their treatment and even follow up with other treatments. So that's there. And I have the fifth point as what they're doing is they're checking in financial accounts. So depending on your experience, not every person is checking in financial account. It's usually the office manager or someone who's very experienced checks in. You have all these things like credits and debits. You're going to see like something, everything in red. Like I feel like red, it's going to be more like credits, but it really depends on your software. Credit is the patient's good, and they have that much money in their account, like it's that way. And so it's a good thing to know a little bit about how the credit debit and how to balance it out, and how much the insurance has paid for each and every treatment, if you can read that, and then how much still the patient owes. So that would be like yeah, that's still bill in green, or if I remember correctly. But yeah, they have to do all the financial parts, like debit and credit. Then you have the sixth thing I have up here is they're going to be sending out the dental claims. So once the dentist does the procedure at the back, at the end of the day, or once they're done with the treatments, what the front desk does is they're sending out um, they're sending out the claims to the insurance. Like if it's someone who is paying out of pocket, like if they're paying through a check or cash, that's fine, it's settled up there. But if you have to send it to an insurance, what you do is you're sending out a claim to the insurance that in this practice the dentist today has done this procedure. And if you want, you can be attaching like the patient charts, patient x-rays, what are the doctor's notes, whatever is required for the claim to be sent out. And for orthodontic treatment, they might need few extra photographs, a cephalometric, like the CBCT, or like the cephalometric x-ray, whatever is required, that needs to be sent out as well. And once you send out the claim, what happens is the insurance send back an EOB, that is called an explanation of benefits. So how much does the insurance, how much is the insurance going to cover? The insurance is going to give a breakdown. It's like, suppose for filling, I'm going to be covered, the insurance is covering 100. For another filling, it's 100. For maybe dentures, they're covering 500. So maybe the patient, had like a denture before, like anything 5 years ago, and it's just 2 years, so the insurance is not going to be covering for that. So they're going to be giving you an explanation about what procedures they're going to be covering and what procedures they will not be covering, and what is the reason for that. Sometimes you might have put in the wrong code, so you want to double check that. So that's what they're doing, like they are reading the EOB at that point. Before sending out the EOB, what they do is send out the pre-authorization for most of the treatments that are required, like your SRP, your crowns, for your implants, for your orthodontic treatment, anything that's a major thing, like in a major procedure. They usually send out pre-authorization, and again you're sending in your diagnosis, your notes, your x-rays, your charts, whatever is available with you, the practice is going to send out. So that is what they're doing up there, they're sending a pre-authorization. So maybe you'll have to wait a couple of days up there for the pre-authorization to come back. And yeah, so that's, and there are like few insurance, like few HMO plans, they actually want you to send a paper copy. Most of this is electronically sent, but there are a few plans who want you to send a paper copy, so they would have to print it at that point and send it to them. The other thing that you do is you post the EOB to the accounts, like, depending on what they are saying that the insurance is going to pay, then you go ahead and, like, post it into the patient's account. Like, okay, the insurance has paid this much amount for these procedures. So that's what they're doing. The seventh thing would be to be calling their patients for recall and for making appointments, like for new patient appointment or just like a procedure appointment. So that's what they're calling in the patient for. And then towards the end of the day, they need to make sure that, like suppose a patient all the patient like suppose if a patient scheduled on Friday, so on Wednesday they're going to make sure that they're going to make a reminder call for them, so that they know that it's just like a reminder call. Sometimes the patients do pick up, sometimes they don't, but those calls that you get, like, hey, you have an appointment at this time, and see you then for this procedure, it's to confirm with the patient that they're going to be coming at that time. So that's a reminder call as well. And the last thing what they do is they're doing the cash tally. So people who paying, like end of the day, patient does have some copay, and so how do they pay that? They're paying it through check, their credit card, or cash. So if it's check, what they do is they're scanning their check and they're going to deposit it electronically and maybe send it out in person if that bank does not accept electronic checks. So that's what, maybe once a week or twice a week, depending on the practice, they can do that. And then cash, they're definitely collecting cash. So you want, end of the day, you want to make sure, and because it's not your practice, you're doing it for somebody else, you want to make sure that you've collected the right amount of cash for each patient. So what happens is, I feel like there was like a financial conciliation report or something, that's it's called, like you just ask it, the Eagle Soft, I think, yeah, Eagle Software. No. Yeah. So if you go to, they have, it's a very handy up there. So you just have to click on the financial report conciliation form, and select it for the day. So otherwise it's going to be printing out for the whole month or whatever it is reset to. So you want to have it for that day, and then it will let you know that how many patients paid in cash, like what was the cash amount, what was the check amount, or some, like it's going to give you all those breakdowns. So you want to tally it with that, and then figure out, like you figure it out, like if have insurance, like you've already posted what the insurance has paid. So everything needs to be tallied together, and like all the numbers need to match up financially. So that is towards the end of the day, and that is one thing that takes a lot of time. Usually would dedicate like maybe an hour or half an hour, depending on how much how much money did they make during that day. If it's a busy day, then obviously you need to start working on it. But yeah, so that is towards the end of the day, you do the financial tally and it's done. So those are the things that they do. And bye bye.